James Thomas, again, we're doing our series in conjunction with St. Louis Community College. Today we're here at Forest Park campus with Steve Newcomb. How are you, Steve?
I'm good. Good. How are you today?
Doing good. Now tell the audience what you do here. What do you do?
Well, my job is that I'm the program director that oversees EMS, which is all the paramedics and the EMT programs that are located at other campuses.
So tell us about the EMT program here at Forest Park.
Okay, so EMT is basic life support, and so it's the stepping stone to get into paramedic class, to become a paramedic. We offer, it's a 1 semester class, 16 weeks, that involves 60 hours of clinical time at a hospital or an ambulance service, and then they also have skill days, like that's what we were practicing today, is skills on how to do blood pressures and take pulses and stuff like that. So EMT is offered at all 4 campuses, Flo Valley, Wildwood, South County, and here. Different time slots, some are at night. If you work during the day, some of them are in the afternoon, and my class runs 9 to 2 during the days on Tuesdays and Thursdays.
So it's just a 16-week course, or is it
Yep.
a longer course?
No, 16 weeks is what you need to complete your EMT side. It'll qualify you to take national testing, and then once you get your national license, you can go pretty much anywhere in the United States and work. You just take your national license, and if you want to work in Florida, you take it there, and they give you a Florida license.
You know, we're getting ready to take a good look at the facility itself. Let's talk a little bit about something I got excited about the last time I was here. You guys have a back of an ambulance here that is just, is that part of the training?
Oh yeah, the ambulance is awesome because it simulates real life scenarios. So we actually make the students, in fact that whole lab is set up for like a living room, and so if somebody was to have an incident in a living room, the students will go in there, they'll treat, they'll have to bring the stretcher into the room and maneuver it through small areas, figure out how to get that patient on the stretcher, and then get them out and then put them in the back of the ambulance just like you normally would. And then they jump up there, and then we give them 10 minutes, 15 minutes, say, okay, you got 15 minutes for you at the hospital, what are you going to do now? And they start working in the back, and the ambulance is completely set up like a real ambulance, so they can put them on oxygen or use whatever tools they need that's already set back there.
I keep thinking about Mother Jugs and Speed.
Yeah.
I keep thinking about that.
Yeah, with a riding in the back.
Yeah, riding in the back. So what else can we, before we get into that, what's the shortage like? We keep talking about here in the region, there's always a shortage of health service people. How much of a shortage is there in EMT and paramedics?
Well, ever since COVID hit, it's been crazy. The amount of use of EMTs has increased so much. They've got places like Total Access Urgent Cares will hire EMTs and then give them additional training to help them take care of the patients that come in there. So they're used as techs in emergency rooms. They're used as transport at Children's Hospital. So the EMT program is set you up for a lot of positions. Medic One, Abbott Ambulance, all of these are places that need EMTs, and there's definitely a shortage. And then of course the shortage extends into paramedic. That's where we really need them, is the paramedics, because paramedics, just like being an emergency room doctor, the stuff that we do is just like being a doctor, but we're out in the field. We're not doing what the emergency room doctor does there. We do it in the field. So,
do they get that in the classroom here?
Yes. Yeah. When we do the paramedic program, they're trained on how to do everything from needle decompressions to tracheotomies. There's delivering babies. We do it all. So,
I have a question I want to ask, and I'm not quite sure if we're going to keep this in the show, but the question is, we have these shootings every weekend.
Yes.
Is this something that they experience in the classroom as far as treating wounds and gunshot wounds?
Yes. We have 2 levels. You have medical emergency, you have trauma, traumatic injuries. And so part of the class is all based on taking care of the person with the heart attack or the stroke or the seizure. And then the other part is strictly dedicated to treating trauma and how to make sure that they make the priority that's the first thing they're going to do. So if they are shot with a gun or stabbed with a knife or whatever, that they're managing airway, that they're taking care of any type of massive bleeding. They've got the programs out there, Stop the Bleed. All these are geared toward helping these incidents from, your active shooter situations at schools to just what they deal with here in the St. Louis area.
We're today at Forest Park Community College, the campus itself, St. Louis Community College, Forest Park, and we're talking with Steve.
Yes.
Okay, and about the paramedic and EMT program.
Yes.
And I can't wait to get down there and take a good look at that ambulance.
Yeah, that ambulance is sweet. There's the next step too, just to let everybody know, is the next coolest part is if we can get it arranged, we're going to have a driver simulator. I'm gonna shoot to get a driver simulator put in there, so it'll be like a VR where they'll actually sit in a thing, put a VR on and drive an ambulance to an emergency call and actually have to maneuver through stuff and see what it's really like to drive an ambulance. So that's going to be pretty cool. That's going to be part of our program.
Especially with those who play those games. Anyway.
Yeah. If you like VR, it's right up your alley.
Definitely. Thank you again for joining us.
All right. Thank you.